bacteria gets into the blood circulation and gets to the uterus, it could kill the baby. The findings from my lab and from my colleagues' labs, I think, could be potentially challenging the paradigm, because when you find an intrauterine infection, it's usually believed they originate from the vaginal tract. But we're showing with increasing numbers that a significant portion actually do not come from the vaginal tract, but they could come from the oral origin. So based on what we have seen, oral bacteria could account anywhere between 10 to 30% of these intrauterine infections. So it is a very significant cost. Not just financially, but it's also very emotionally, because if a family loses a baby, it's detrimental. People are very hurt, and they're hurt for a long time. And so they want, the question I'm always asked is, what did I do wrong? What can I do to prevent this from happening to my family again? So I think that's the big question that we want to answer.
In addition to causing birth complications, research studies have shown that women who have gum inflammation and infection and are undergoing infertility treatment have delayed results. It's much more difficult for them to get pregnant. This has been attributed to the extra hormones they are being given, which are being absorbed into the estrogen receptors we have in our gums. And in the presence of plaque germs in the mom's mouth, they cause inflammation, bleeding gums, and infection. But it stands to reason, whether a woman is taking infertility drugs or not, if she has bleeding gums, infection, or even if she just has high levels of bacteria in the mouth, then the body is going to be in a state of poor health, and pregnancy might not be possible. In American hospitals alone, the Centers for Disease Control estimates that hospital-acquired infections, an infection you didn't have when you came into the hospital but got while you were there, account for an estimated 1.7 million infections and 99,000 associated deaths each year. And for some of those who survive the infection, their lives are changed forever.
I'm an advocate for patient safety, and I have a passion about it. They call it obsession where I work, but it's just a passion because I love to protect my patients. That's what I do. One lady told me, I asked her if she had periodontal disease, and she said yes, she knew she had it, but that it was expensive to treat. She didn't have dental insurance, and she was having a total knee put in. So she had her total knee. She went home. A few months later, she got infected. They had to take her knee out, and then she had to live without a knee for a while. And then they put a new knee back in. It got infected. They took it out, and when I was her nurse, 2 years later, I was her nurse, they were amputating her leg. And she didn't know anything about periodontal disease, but she had an infection. And when she went into surgery, her husband told me that the cost of their medical bill for the past 2 years was $2 million.
They now tell us that half of America has a condition known as periodontal disease, which is more significant and more severe than gingivitis, which people get from time to time. But half of the people, what it says to me is half the people that now go into surgery have this condition. There are a couple of ways that this is a problem. In surgery, it's not that the bacteria from the patient's mouth is going to end up in, say, like a knee surgery. It's that the body can only fight infection on so many fronts. And it's like a war. It has a certain amount of resources it can allocate to that fight. And when you have an infection elsewhere in your body, it's allocated resources to that infection site. And then when you go in and do a surgery, you create another wound, and that wound demands that the body put attention to it too. So the reason you don't do surgeries on patients who have infections is because it diminishes their ability to recover from the surgery and increases the likelihood that any other bacteria could then take hold because there just aren't enough antibodies to fight that infection. From a financial point alone, if you look at the cost of a standard post-operative infection, it's between $15,000 and $30,000 per incident. And that's a cost that's generally borne by the hospital itself. But if you really want to know the truth about what we're being able to do, when you look at the long-term care industry, 90% of those patients have an oral infection. 90%. And when you think about that, and you realize these patients have a lot of other conditions. They have heart disease, they have diabetes, they have ulcers, they have pressure wounds. All of these are made bad or worse by this periodontal condition. The real good news is that there are easy, non-surgical ways of correcting the condition that you can get from your local dentist.
It's clear to see that the inflammatory burden caused by periodontal disease is a serious problem. But the mouth is also the home of many other preventable chronic diseases that plague our society, some of which goes untreated and undiagnosed for years.
I would be able to, be drowsy, because without a good night's sleep, it just, like, I could be driving like this, I'd be okay, and then, get to a stoplight and waiting for the stoplight to turn, my eyes just get real heavy, and I'd be like just sitting there stopped, and then the car behind me would be honking and be like, oh, the lights changed, it's time to go.
About 2 years ago, my life was much different than it is today. I was not sleeping well at night, and it was starting to affect other parts of my life. I was at work, and I dozed off between telephone calls, and I did get in trouble for snoring at work.
I was probably in about the worst condition of my life, being obese and with the untreated sleep apnea.
At the highest point, I was about 285 pounds.
But yeah, that's probably me, about 75 pounds heavier than today. I was wearing 42s and pants.
It was like having a ball and chains or a weight strapped to me that I was just having to carry with me every day. I went and saw Dr. Jeffrey Lowe. I was just in there to do routine cleaning, and they were talking about how I slept. One of the questions was when you're having a conversation, much like what we are now, and that was one that would be, something that could be likely for me to feel drowsy or doze off. And I said, yeah, I've done all of these things.
So we had him take the home sleep monitor home, and he took the test, found out he had severe apnea. Nothing we can help him with here, not with appliances that we can create, but we did refer him to the hospital, who, after many phone calls, found the sleep physician that could help him, and they got him on a CPAP.
My AHI was over 100, which essentially AHI just means how many times you stop breathing during an hour.
And he swears we saved his life. He's lost weight, started to exercise. He just could not feel better because he went to bed rested and woke up tired instead of going to bed tired and waking up rested. So he couldn't even fight his day.
It's nice to know I can be a functioning person of society and not have, other complications or not feel tired. That's the big thing, is just to have energy throughout the day. I started becoming more physically active, and then I bought a bicycle. And now I ride the bicycle almost every day. New Bob is definitely different. For one thing, all of the questions, how likely I am to fall asleep, And all of those conditions, it's always a never now. So I get to check never. I've dropped at least 10 inches just in my waist size. In fact, the weight was coming off so fast at first. It was like every couple months I had to go and buy new clothes again. I feel like the way that the dentist views complete health, instead of just looking at me as a mouth, but as thinking of me as a person, has been instrumental in my transformation.
And I think that's what's missing, is just a conversation. The fear that, well, if I talk to him about sleep apnea, he might go someplace else and never come back to this practice. We don't have that fear. We have the, what if he doesn't get his sleep apnea treated? What if he doesn't make it to 50? What if he ends up with high blood pressure and is eating 4 different types of medicines? What if it could be easily just treated by letting the guy get some air while he sleeps? Because that's what's happening every day in this practice.
The mouth is also home to one of the biggest killers in our country, oral cancer. Every 60 minutes, one person dies from oral cancer. That is one person every hour, 24 hours a day. Sadly, it affects people of all ages, nationalities, and walks of life.
My first appointment here was September 29th of 2008. That is when I was given my diagnosis. It'll be 5 years in September.
Denise is one of, unfortunately, a typical story. A typical story in the sense that here is a patient that's been pretty healthy and doing well, and has some growth in the mouth, and typically by the time it is recognized as an advanced stage.
It all began in July of 2008. I had a broken tooth, and I went to my regular dentist, and he said, I need $13,000 in dental work. I have an abscess. He gave me an antibiotic, and that was it. And I told him I don't have the $13,000 to do the dental work right now. I couldn't worry about it. I was a single mom raising my 2 children. I went through a horrific divorce just 2 years prior to my diagnosis. So I let it go. About 2 months later, I broke another tooth. So I went over there to go see Dr. Israel, and he looked, real quick, and he said, oh, this is terrible. We need to do a biopsy and a 3D CAT scan immediately. You have a growth in there.
She already presented with what's called a stage 4 disease, meaning that the tumor had grown substantially, not only in size, but also had metastasized, had gone to the lymph nodes in her neck.
The left side of my face was so normal, you can make out where my teeth were, my cheekbone, my jawbone, my gums, everything. My right side was a black hole, basically. It was all black. So my option was to go home and not do anything and only have a few months to live, or opt for surgery, chemo, or radiation, and hope that it worked. So I said to him, no, let's do it. We need to do it. I have 2 children at home. If I don't make it, they're going to be without a parent, because I am the only parent that they had. And I was determined not to let it win. I was determined to beat it, because I had to be here for them.
We discussed the plan with her and her family. She accepted the plan, and then we embarked on the treatment. And the treatment for her was, doing the surgery, which was called a maxillectomy. That means removing the tumor from her maxilla with the upper jaw. Fortunately for her, we were able to save her eye, which was an important thing. And then we then at the same time did it's called a neck dissection, meaning removing the lymph nodes from her neck. And at the same time, we transplanted the fibula, which is her leg bone, and made her a new upper jaw.
When my doctor did the surgery on my face was swollen, but you couldn't tell what he did to me. And then chemo radiation started, and radiation deteriorated everything that he did. So what you see now that is destroyed is due to radiation. So since 2009, after chemo radiation was over, they have been trying to reconstruct my face because of what radiation did.
Is this a kitty-sized bed?
Feels it.
Is this like the furthest your feet have ever gone to the bottom?
After all these years, I'm still not finished, but almost done. Yay. And I'm here, that's all that matters, but nobody caught it in the beginning. So if it was caught originally, it might have never turned to stage 4. I might still not be battling what I'm battling now. There is a way to detect oral cancer in a dentist's office immediately when you go for your cleaning and checkup every year. All they have to do is screen you for it. It takes a minute for them to do it. Between what my insurance has paid, donations have paid, anonymous donor has paid, I have to be at least up to $4.5 million in medical. It's early detection, preventative health care, and all the money that was spent on 17 operations could have been prevented. You're never going to get rid of me, even when I'm better. I'm never leaving.
That's a good problem to have.
I'm never leaving.
Denise is very energetic and very engaged and committed to life.
There's one of the two of them.
The other thing that also I think is very important about Denise is her family life. She is adored by her kids, her mom, and they're always there. Clearly, there's a very tight-knit family.
There's no way that we can go about our daily lives without her. She's such a huge part of it that it wasn't an option for her to not be here. So whatever it took, we were all gonna get through it together. Okay.
I love you guys too.
In healthcare, we are twice as expensive as Europe, 4 times as expensive as Mexico, Japan, India, and China. We've got to be competitive in medical costs. That's where major companies have figured this out. And they're putting in incentive programs and wellness programs in a greater degree to encourage preventive care. We have hit an inflection point in our total cost that we have to get less expensive. And the only way we can get less expensive, or the only 2 ways, are rationing or getting rational and taking care of ourselves. If we can do that, and in fact take care of our teeth, we're going to be in much better shape.
A recent study by United Concordia, the largest of its kind, looked at the health of over 1.7 million people and found that almost 200,000 had both chronic conditions and gum disease. Then they looked at those within that group who were treated for their gum disease and those who weren't. The financial savings annually by those treated were impressive. Diabetic patients treated for their periodontal disease, $3,291. Patients with heart disease treated for their periodontal disease, $2,956. Stroke patients treated for their periodontal disease saved $1,029. Patients with rheumatoid arthritis treated for their periodontal disease, $3,964. And pregnant patients treated for their periodontal disease saved on average $2,430. All this simply by getting a healthier mouth.
So just to go over what we're going to do today.
For the mouths of America to get healthier, there is a specially trained group of men and women in this country who will have to step forward and provide preventive care.
Is we're going to get you healthy.
Some refer to them as oral medicine specialists. We know them as the dentist. Not exactly the first person who comes to mind when thinking of solving our nation's health problems, but if you think about it, dentists are in the perfect position to make a tremendous impact on our healthcare system. Traditionally, the general public is already in the habit of visiting the dentist every 6 months, way more often than the average American visits their primary care physician. In addition, it's already been proven that prevention is significantly less costly than trying to cure people, and so considering the 162 diseases that can be detected in the mouth, dentists are the ideal provider to watch and care for individuals. In essence, the system is already set up for the solution.
Okay, so brush your teeth, floss.
But if this is the case, why then are things not working like they should? It's simple. There has to be a contextual shift in how we think about the mouth in dentistry.
In working with dentists for the past 19 years, I've really learned something profound and had a profound awareness. I was watching the movie Hangover, and in the movie Hangover, the guy walks up and he says, I'm a doctor, I'm Dr. Stu, and he goes, his friend says, you're not a doctor, you're a dentist, you know? And at that moment, I realized at that moment, something really needed to change, and there needed to be a person that stood up for and advocated for the dental community. The source of what has to shift in dentists is that they're trained to find the chief complaint and fix it. That's a reactive care dentist. They walk into a room and they ask the patient, is anything bothering you? Is there anything wrong? Now the dentist is looking through a wider scope, a wider viewfinder, and now being a screener, looking at a wider context of treating the whole person versus just the mouth. And we're not saying dentists are going to replace medicine. No, they're now partners with. And they are the first line of defense because the mouth is that first indicator. And check this out. 9 out of 10 patients who go to a dental office do not have a primary care physician on their medical history form.
The dentist, the hygienist are critical to maintain vascular health and wellness. It can't be done alone. And then from the other side, the dentists and the hygienists need to realize that their work has systemic merit. So both communities, medical and dental, need to start talking.
Dentists and the physicians both need to be aware of this connection, and both sides need to come together and to provide integrated care to the patients.
Well, there are a variety of gaps that sit between health and health care, that sit between access to care and utilization of care, that sit between medicine and dentistry. And there's, in general, for our purposes, a lack of appreciation of the import of the oral cavity for the rest of the body. So if we want to see diabetics stay healthy, if we want to see pregnant women do well in their pregnancy, if we want to see people sustain good health, we can't afford to have some significant aspect of our body with chronic infection or chronic problems.
I feel so strongly that dentists could be a part of that preventative care. They're changing the model in how they're paying physicians, and physicians could only help to benefit from adding dentists to their team and adding hygienists to their team, because we look at things in a preventative mode.
People are impressed by that type of dental care. And as physicians, we need their help, because there are a lot of people out there, they won't see a physician in a year. Most patients will see a dentist at least once or twice a year. So their exposure to these people is higher than ours. And they all need to be educated on this, because it's not just the physicians who don't recognize this link. Believe it or not, there's some dentists, I think, you still don't believe it, or they're not on board with it. That's got to stop.
The public, government, insurance, caregivers, and even dentists themselves have to begin to think of dentistry as part of the first line of defense against disease and sickness.
today we went through the Healthy Mouth baseline. Oral cancer screening was negative today. Everything looked good.
It's now happening within a movement called complete health dentistry,
Blood pressure was 110 over
where the
82.
dentist is no longer looking at patients as just the mouth, but looking at the complete health for each individual. Dr. James Lisinski of Buffalo, New York, is one of many dentists who are making the shift from traditional dentistry to complete health dentistry.
When we graduated as dentists, we were taught to be problem fixers. But now, with this new context, body affects the mouth affects the body, has allowed us to look at the whole patient and see exactly, what's going on. We found when we started asking people about their general medical history and their family history, we found that a lot of them hadn't been to see their physician for a checkup in years. So we can engage conversations with them about everything from smoking to weight to exercise to getting that appointment with their primary care physician so they can get that physical checkup. What we're doing is we're not treating their high blood pressure when we take their blood pressure, but if we see that they have any of the signs and symptoms of that, we're then encouraging them to get to their physician and have it treated. We have multiple ways of searching for oral cancers. Digital x-rays, we have digital Panorexes, digital periapical x-rays. We also still use visualization, palpation, the tactile feeling of the lymph nodes of the patient. So we try to do the best we can, finding any growth at its smallest stage. In complete health dentistry, we also have what's called the Healthy Mouth Baseline. It's a tool to help us educate the patient what we're looking for. A lot of times patients are sitting in the chair and they don't know what we're doing. We're able to show the patient, this is what we're looking for. This is what is healthy. This is what is disease. There's no one person that's going to slay this dragon. I mean, these chronic diseases cannot be solved by one person. We, as a community of healthcare providers, need to work together as a team so that we can get the solution to keep those people that want to be well, keep them well.